For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Thank you all for joining us today. My name is Todd Nafziger. I'm a public information officer for the Emergency Operations Center for the County of Santa Clara. Today we are joined with Dr. Fenstersheib, and we're going to discuss the current status of where Santa Clara County is in relation to COVID-19. Dr. Fenstersheib, thank you again for joining us. COVID is continuing to impact our community. Cases go up, everything's increasing. We're at a state where we haven't been yet with this pandemic. Can you paint a picture for our community as to where Santa Clara County lies right now in relation to COVID-19?
Yes, I'll try to, Todd. The news isn't good right now. I mean, we've all heard this constantly. There's more cases, people are dying, but it still continues on. And we're seeing more cases now every day than we've seen at any point in this pandemic in Santa Clara County. We're averaging now well over 1,000 cases a day. Just for comparison, back in July, when we thought things were pretty bad, we were seeing maybe 300 cases a day. So we've tripled that. And unfortunately, yesterday was one of our worst days, maybe our worst day for people who have died from this disease. 24 people have died from this disease. So we're not anywhere out of the woods yet. With people dying, with the numbers of cases, the problem is that our hospitals are filling up. Mm-hmm. And right now, hospital beds and ICU beds are dwindling. Perhaps only 15% of our ICU beds. So if you can imagine, in a county of 2 million people, we only have 15% of our ICU beds available. So it's very, very important that everything we do be really focused on keeping people well and keeping people out of the hospital. Now, it may not be, maybe you out there that are listening are young and feel like this is not your issue. If you get the disease, you get the disease. But just think of potentially infecting a relative, your mother, your father, your grandparents, and they end up in the hospital, and God forbid they die. So it's everybody's issue, and we all are in this together until we can get out of it. But for now, we have to be vigilant.
Absolutely. That's a very important message, and thank you for delivering that. And our condolences go to those family members and community members who've lost people to this disease as well. With that being said, too, Dr. Fenstersheib, we have federal approval and federal authorization and state approval for a new vaccine. The Pfizer vaccine has come to our county as well. Can you kind of let us know how many we've received and when will that start being administered?
Yes. So we're really excited. We're starting to receive vaccine. In fact, yesterday we received our first doses of vaccine. We were very, very happy about that. The federal government has prioritized those people at highest risk that are going to get the vaccine first, and that's only appropriate. I mean, we're going to vaccinate people who are taking care of us in hospitals, so all of the healthcare workers will be first, and we want that to happen. We also are going to vaccinate people that are at highest risk because they're either elderly or they're in a skilled nursing facility. So everybody in a skilled nursing home or those people that are working there are also at highest risk. So those are the two main groups that we're going to focus on right now. And we received vaccine to begin vaccinating those skilled nursing workers. And then by the end of the week, hospitals will get their own vaccine and start vaccinating the healthcare staff within the hospital.
That's very encouraging. That's great to hear, too. I know this is something we've waited a long time for. So we have the Pfizer vaccine that has come to the county. There's also the Moderna vaccine as well. Do we have any updates as whether or not we'll be utilizing that vaccine, too?
Right. So there's two vaccines that are coming quickly. Pfizer has been approved already, and that's great. In fact, we're actually getting a total of about 18,000 doses of the Pfizer vaccine. The Moderna vaccine, again, that's just the name of a company that's produced this vaccine. They are going to go before the FDA, the federal government's specific office, which basically will approve, listen to all of the data that they've accumulated from the tests and trials, and hopefully approve that. In fact, they're meeting tomorrow. So if that gets approved, then we will next week receive nearly 40,000 doses of the Moderna vaccine. Again, we're going to be prioritizing healthcare workers and residents of skilled nursing facilities.
Oh, that's so encouraging. I mean, you can agree as well that vaccines are very critical for us to stop the spread of COVID-19 in our community. How prepared is our county to distribute these vaccines to all these critical sectors?
Right. We have been working very closely with the hospitals and other providers right now, and it's a slow rollout initially because the vaccines are coming in dribs and drabs now. We really need, there's 2 million of us in this community, and we need everyone vaccinated. So it's going to take several months. But I personally feel like this hopefully will mark the end of this pandemic. And so basically it will take several months to get these vaccines rolled out, but they look good, they look very safe, and hopefully very effective. We'll know more as we move along. But again, we all have to basically stay vigilant and wait our turn for the vaccine, knowing that there is an end to all of this.
Absolutely. And that's a hope that I think our community really needs to see, is that vaccines are here, they're coming, and this is our route out of this horrible pandemic. With that being said as well, too, our county has recently provided additional guidance when it comes to quarantine. Can you really speak to that and enlighten our community as to what changes have actually occurred?
Yeah, and we can make it very simplistic because it's a simple change, but the CDC, the federal government, basically through its research and looking at the various data, has determined that we don't need to wait for 14 days after we're exposed to somebody, when we're all talking about waiting 14 days of quarantine. And that 14 days has been decreased to 10 days. So that if you get exposed to somebody that's a case, then basically we're going to be quarantining yourself, meaning away from everybody, for just 10 days and not 14 days. And if you were exposed, also we want to remind people that we would like them to get tested, but wait until at least day 6 after your exposure to be tested. Unless you have symptoms, then we want you to get tested right away. But the main message here is that stay safe, don't get exposed. If you do, you must quarantine to protect everybody, and you only have to quarantine 10 days.
Great. I know that's a little bit of a shift. It's a simple one, but it's very impactful to our community as well. And thank you for also reiterating testing is so critical for us right now to identify where this disease is and how we can stop it as well. Not just waiting for the vaccination, but you're right. Just maintain your social distance, get tested when you meet the criteria, and so forth. So we are in a holiday season. We didn't think we would be here for this holiday as well, too, given our current status. Do you have any advice for our community as to how they should modify their current holiday practices to make sure that they can be as safe as possible?
Sure. I mean, I know the message sounds monotonous and we keep saying the same thing. We said the same thing around Thanksgiving. Unfortunately, lots of people traveled and they had gatherings, and what did we end up with? We ended up with a situation where we've had lots of cases. Our hospitals are overwhelmed right now. So we have the Christmas and the winter holiday season. We really urge people to please stay home. Enjoy a quiet holiday season with your family this time. My own father, who's going to be 94 years old this month, I can't go visit him for the holidays, and I'm very sad about that. But he knows, and I know, that this is the way that we'll protect each other. I don't want anything to happen to him, and I'm sure people don't want anything to happen to their family. So let's be vigilant. Let's do what we have to do this time, and we'll hopefully all be together next Christmas and next holiday season together with our family.
Absolutely. I can relate. I have a brand new nephew that came around 3 months ago. I've yet to see or hold, and I'm very fortunate to have a very understanding family that realizes that we need to sacrifice the time now to be able to enjoy that time later with the least amount of impact to our family. Again, Dr. Fenstersheib, thank you so much for being here, helping us deliver this very important message and giving our community that sense of hope that they've been longing for a long time, especially with this vaccine, because it's just been looming for so long, waiting for it to come, waiting for new information. So now that it's here, I greatly feel that this is a good sign for our community to start taking those steps to get out of this horrible pandemic. But thank you again for joining us. With that being said as well, thank you everyone for tuning in. Please continue to socially distance. Stay more than 6 feet apart from people when you're leaving your home. Always wear your face covering. And also remember to don't gather with people outside of your household, and do not travel this holiday season. Thank you all again. Be safe, and join us next time for our Facebook Live. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.